All right, so today we are going to have Jean Dugan with us from Bay Aging. She is the outreach coordinator for VICAP. And over 40 years, she has been very involved in public service, everything from fundraising, grant writing, public relations, providing education through Virginia Cooperative Extension, and also through formerly community education, now community engagement and public information with Gloucester County. So she's been very involved in our community and is going to speak with us today on fraud, particularly through Medicare fraud and other for older adults, and learn how to protect yourselves against that. So I'll go ahead and let you get started.
Thank you all very much. It's very nice to be with you all today. So my role now is strictly outreach, and VICAP stands for Virginia Insurance Counseling and Assistance Program. And so we provide counseling, outreach. Counseling can be in a group setting or one-on-one for people who have specific questions. So we cover everything from Medicare to Medicare Advantage, other types of insurance. But our role, specifically for both VICAP and Senior Medicare Patrol, is to educate, counsel, and assist. So that's really important to us, that people have the information they need to be their own best advocates and to make the best decisions they can for their health care, and also to protect themselves against Medicare fraud. And there's Medicare estimates $60 billion lost every year to Medicare fraud, but it's more like 90 to 100. And this morning I looked up a couple of cases just in Virginia, and one Virginia doctor pled guilty to $1.8 million in healthcare fraud to prescribe medically unnecessary compounded pain and scar creams and other expensive medications. There are scams out there for catheters. It's a thing. I don't understand it, but it's a thing. There's a medical practice in Roanoke that paid $2.1 million related to asthma and allergy-related treatments and fraudulent billing for services that were never received. So you multiply, that's one state, 2 instances, you multiply that by 49 states and territories, and you can see how the numbers can easily go up into the billions of dollars. And it affects not only people who are retired, it affects you. It affects everyone because there's less money available. And so it's really important for people to be aware and to learn, and if they suspect fraud, report it. That's how we catch people. And so fraud can lead to higher premiums, less money for needed benefits, less quality treatment. I'll go one step further for younger folks. It could mean fewer resources for you when you retire. So everyone has a responsibility. You know, when we think of Medicare, we think of folks like me. And so we already received services. But what I was saying is that you also need to think about yourselves and at this point in your life and how this will in general affect you. Because if there are fewer resources, then it will make it more difficult for you to access healthcare services. So what you can do to protect yourself, and don't do like me, or what I used to do is I'd get my quarterly Medicare statement, and I would look in the section that says, you may owe, and if I was pleasantly surprised by seeing all zeros, I said, well, okay, that's that, and file it away. You should not do that. And I don't do that anymore. It's important to read the quarterly statements. And so if you have people who are on Medicare, please tell them to look at their quarterly statements. That's where you find mistakes. It can be fraud, it can be abuse, it can also be an error. It could be something as simple as a coding error, and you can call your doctor's office. But it's important because that's how fraud in the millions and billions of dollars is caught. And so if you suspect something like that, in the material that I gave you are the numbers to report it. And so people really need to, that's why I am my own best advocate. And I learned that through doing this type of work. And so I always encourage other people to pay attention. If there's something you don't understand on your statement, call us. It's as simple as that. And we can walk you through the process. Lisa Walker, who is my supervisor, works with thousands of people every year. And it can be something really complicated. We had a lady last year who lives in Westmoreland. For some reason, someone in California had her Medicare number and was using her Medicare number to access services. So that was a mess, but Lisa finally was able to work it out and everything was resolved. So it can be something like that to, again, just an error. But it's important to let your clients, people in your family know that these services are available. I'm not going to do a deep dive today, but if you do have people that you think would benefit from something like this, please have them call our office. There's an 800 number, 1-866-758-2386, extension 1235. And if they don't answer, please leave a message. They are very, very good about returning calls, and they are very diligent about helping people. And then Senior Medicare Patrol is a volunteer program. So if you or you know someone who would be really good at doing this and going out into the community and helping us spread the word about fraud, Medicare fraud specifically, then please, again, call the 800 number, let us know. We have trainings every year. We have to be recertified every year. And the services that we provide are at no cost to the clients. They're confidential. And what's nice is that we don't sell insurance. We simply advise, we provide the information, and counsel people on what their choices, their best choices may be. But in the end, people have to make their own decisions based on what they need. So that's Senior Medicare Patrol. And we also do, again, Virginia Insurance Counseling and Assistance. We are particularly busy between October and December. That is the annual enrollment period. And this is particularly important because this is a time where people can look at their plans and say, well, you know, I may want to change from Medicare to Medicare Advantage. Well, what is involved in that? Or in my case, Jim and I have original Medicare, we have a supplemental insurance, and we have Part D. That's the way we decided to go. I thought it was important with my husband's health that we be able to go wherever we need to go, whether we're in a network or not. That was important to us. Other people are okay with a network. They may not have as many ailments. It's whatever works for you. But this time period is essential for people to review their plans and can make changes without any penalties. You want to avoid that as much as possible. So last year, Bay Aging helped over 1,600 people to answer their Medicare questions, helping them fill out their forms, resolving conflicts that they may have had. And 20% were people with incomes below 150% of the federal poverty level. So it's really, really critical to help people who are struggling, who may not understand. I mean, we're in the business, and it's complex for us. So I can just imagine how overwhelmed some people are. So it's really critical to be able to provide that service. And again, I want to stress that every year we have to attend trainings. We have to pass a test. And we have to recertify, because things change every year. And they change, sometimes there are just so many changes. And it's a maze that you have to work your way through to get to where you want to be. And so we're always there to help, to provide counseling and services, always. Another thing that we do is Medicare improvements for patients and providers. It's called MIPA. And MIPA focuses on Medicare savings programs that can help pay some Medicare costs for health care and premiums. It it covers Medicare Part D, low-income subsidies, and it helps to pay for prescriptions. And we have Medicare preventive services, a whole slew of preventive services that don't cost people any money. And it's on this card. Everything from breast cancer screenings to tobacco cessation counseling, annual wellness visits. So we always encourage people to take a look at this card and to take advantage of these opportunities that come at no cost for them. And it increases their health viability. And so these are some of the things we can take advantage of. We also have this card to get help with your Medicare costs. And it's for people who have low incomes and very few resources. And so it is critical, if you know of someone who is struggling, to let them know that this exists. No matter your audience, your clients, even if they're younger, they have parents, they have aunts, uncles, and it can really benefit them. And we reach out for MIPA. We try to reach older adults, people with disabilities, people with low incomes, residents of rural areas. We're also connecting with the Native American tribes in our region. So we're connecting with them. And people with disabilities under the age of 65. And of course, people who speak English as a second language. So this is really fast, not in depth. Everybody's situation is unique. And so I think it's really important that if you know people, to just let them know that we're there and that they can give us a call. Thank you.